Good morning once again, and welcome to the Haven Financial Group radio show. We appreciate you listening this morning. If you have any questions, please give us a call anytime during the week, anytime really, 612-805-8624, or online, havenfinancialgroup.com. Kim, we have Glenn Ramey on this segment, and because we're going to talk healthcare. That is his wheelhouse. And when I encourage folks to go to our website, these educational classes, we do a lot of them in the community, but we also do them at our education center. And I just want to bring light to some of these that, a lot of people, they're not the stuffy type. We have one, Wine, Cheese, and Retirement Ease on May 7th, Navigating RMDs on May 13th. This is just a few of them. And Glenn's doing a Medicare Made Simple class April 28th. These are at our education center. So go to our website, check out all of our classes, because we're very, very passionate about the education, because education can lead you to much better decision making, and that's ultimately what we're looking for in retirement.
Glenn, you must be a magician to be able to make Medicare simple. I cannot. That is fantastic.
Well, thank you. I try.
Well, we are going to talk about healthcare, and Glenn Ramey is with us. And of course, he is the healthcare insurance expert there at Haven Financial Group. We're talking about Gen Xers, and this is the group 49 to 61 right now, about to be 62. They, certainly on the top end, they're really starting to think seriously about retirement. And we have said here on the show, Glenn, over and over, one of the things that people do not plan for enough is the expense of healthcare, because healthcare in retirement can be incredibly expensive. And I see you shaking your head. You agree?
I agree, most definitely. Healthcare expenses are a thing that we often underestimate, and we don't prepare ourselves for a different phase of life, right? I tell people being new to Medicare, right? Your history on healthcare is not your future on healthcare. What happens in your 30s and 40s and 50s is not what happens in your 60s, 70s, and 80s, right? The old something I say occasionally is a bad news to share, right? We don't get healthier as we age, right? It's just the sad nature of life, right? And going back to that, speaking from the generation I'm in, Generation X, right? We are absolutely going to be facing some different things than our parents have. We're going to be living longer, right? Mm-hmm. We are already living healthier, active lifestyles, eating better. One easy metric I could use right there is tobacco use. Like when I first started 20 years ago, how common it was for someone to say that they use nicotine, right? They use tobacco products. Today, I almost don't even have to ask the question. It's so rare that people are using those kind of things. And all these advances in medical technology and other things are going to help us live longer, which also means that's not necessarily coming without a cost associated with it.
Sure, absolutely. Well, let's talk very quickly here. And I know that you are teaching this class, and boy, what I highly suggest anyone who is listening and they are interested or feeling overwhelmed by the Medicare system, that they attend that class. And again, you can go to havenfinancialgroup.com to sign up. But let's do a cursory kind of look at Medicare, because this is something that everybody, needs to look at. And let's start with, how quickly do you need to familiarize yourself with it? And then maybe you could just give us a few of the points that people need to know.
Yeah, I think it's important to start addressing the conversation maybe a few years in advance, right? Mm-hmm. Because this is something you're going to be planning for and preparing for. Mm-hmm. And there can be a lot of questions you're going to have going through that process, right? And starting to get those answers earlier is going to help you have and develop a better plan for when that day finally arrives. Mm-hmm. I'll start with one of the most common things people don't know, which is when we don't have to take Medicare. Everybody's going to tell you when you do, but very few people are going to tell you when you don't. And that, to start with, is when you work for an employer with more than 20 full-time employees and they offer benefits that are credible for Medicare, as good or better. That allows you to delay Medicare while you're still working, right? Mm-hmm. But for those that are going to be pursuing Medicare when they turn 65, Medicare is going to give them 7 months, 3 months before their birth month, 3 months after their birth month, get all their Medicare in order. And you're going to have some core components of that Medicare benefit, right? Your Part A Medicare benefits. These are the ones you prepaid in with taxes. So when we sign up for them, there is no monthly cost associated with that. And the easiest way I can describe your Part A benefits are it's inpatient. This is the hospital coverage, the inpatient rehab coverage, right? Part B is your outpatient doctor coverage, right? It's your doctor appointments, your diagnostic testing, your day surgeries, your durable medical equipment, and things like that. And that's the one you're going to have a cost to. And today that cost is $202.90 per month. And then you're going to look above and beyond that. Larry hears me say this all the time in our workshop. There's two reasons why you're looking above and beyond this, right? Medicare by itself is a limited benefit health plan. It does not cover infinite days in a hospital. There's actually a limitation on those benefits. Medicare by itself doesn't limit your out-of-pocket exposure to medical bills. There is no out-of-pocket cap to Medicare by itself, right? So we look to one of those components, Part C of Medicare, also referred to as a Medicare Advantage plan, a package of benefits offered by an insurance company, or you're going to look to like Medicare supplements or Medigap insurance policies. And either of those options are going to fix those core problems I just mentioned, but that's why you're going to pursue them. And in either included in that Advantage plan, Part C, or separate with a Medicare supplement plan, you're going to have your Part D prescription drug coverage. And I'll share some good news with people. Last year, for the first time, that prescription drug coverage had an out-of-pocket cap to it. $2,000 in 2025, $2,100 in 2026 is the most anyone can pay out of their own pocket for covered medications by their Medicare plan, regardless of the insurance company they're buying it from, the price of their plan, or their plan design. Prior to that, I can tell you a story of a client who was battling leukemia, and his medications to battle that drug were $16,000 a month medications. And he, even with his insurance, was out of pocket $9,000 plus per year covering his medication costs alone. And no one's facing that anymore with that new change.
Okay, that is some good news. Now, let me go back to what might not be such great news for people. Parts B, C, and D, those premiums are deducted from your Social Security, but the supplemental you do ultimately pay, and you do have to look at that annually, correct?
Correct. So with Medicare, you've got a core cost, right? Your Part B. No matter what you do, you're going to pay that Part B cost I mentioned earlier. On top of that is either going to be your Advantage plan, your supplement plan, your prescription drug plan. And the area that people often are ignoring about the reviewing of that and the importance of the review is the medications. It's how their medications are covered from year to year. These insurance companies are constantly tweaking their plans, their copays, their formularies. And if you're not paying attention to that and reviewing that on a periodic basis, you're missing out on a key opportunity to save money, right? And we all know that when we reach retirement, there's no new money coming in, right? Other than interest, we're living off that savings. And we got to be very frugal with those dollars, not waste them unnecessarily. Both New York Times and Fox Business both have had articles in the past year talking about this is an area where people on Medicare are missing savings, on average $600 per year in savings by shopping their plans out from year to year.
Right. Yeah. And I know that can be very frustrating because you think, well, I've got a great plan. I don't want to get into that again. I don't want to go through all of this. But as you've just mentioned, it can save money when it's all said and done. And maybe not. Maybe you're staying with the same plan, but the opportunity to shop is one usually in the fall. So one thing that is not covered by Medicare for sure is long-term coverage.
Correct.
So that's really important. And this is one I think that scares a lot of people.
I understand why. It is a scary thing to talk about, and it is something that's happening to a large percent of our population. Raw statistics will tell you half of us, 50%, are going to spend time in a nursing home. And that average stay in a nursing home is not 1 month, it's not 1 year, it's 3 years. Right? And Medicare by itself is only going to cover up to 100 days of skilled nursing benefits after a hospital stay of 3 days or longer. But here's the key. The actual average number of days Medicare covers is 27, not 50, not 100, right? That's because that therapy in that facility has to be showing improvement. And the moment that therapist says, hey, there's no longer measurable improvements with that therapy, Medicare is going to be done paying bills related to the care that was being given at that time. And you might have permanent needs that have arisen because of that healthcare event that aren't going away, right? And if you haven't planned for this cost, you're taking a huge risk on your portfolio, right? My easy answer is, do you want to pay $1 when $1 is due, or you want to pay 30 to 40 cents when $1 is due, right? Do you want to leverage your dollar by protecting it and planning for that long-term care?
Okay. So give me a sense of what you're talking about when you say long-term care and what that's going to cost me.
Yeah. So let's start out where it's going to start. It's not going to start in a nursing home for most individuals. It's start at home, right? It's going to be home health care. and often given by family members. So we talk about another thing that Gen X are facing, right? Not only are they having their kids live with them a longer period of time than normal, they also have aging parents that are needing to be taken care of. And they're having to step away from their own families, their own children to take care of mom and dad, right? So this is the importance of planning, to give permission to your family that you don't have to be the ones to take care of me. I've already planned for this. We can bring someone in to help relieve that pressure on the family and let a professional do that help for you, and funding that through different vehicles that could be available financially for people.
Mm-hmm. Some of those vehicles very quickly here are insurance, obviously.
Yes. Yep. So we got like traditional long-term care insurance, great for people that are worried that they could run out in a long-term care event because they could get asset protection against Medicaid spend downs. And for those that are better savers, the reasons people didn't pursue long-term care before are kind of changing. The worry that if it doesn't happen, nothing happens, right? The insurance company wins if nothing happens. There are vehicles you can do in long-term care planning where that's not going to be the end case scenario. It's either going to be you're going to get more money for long-term care bills when they happen, or if they don't happen, your money's going to go back to the family. And one thing that's there for really good savers now is long-term care annuities, right? Leveraging our dollar without giving it away, without giving any dollar away to an insurance company, but just repositioning savings to say that if that savings is needed for long-term care, it's way more than that in that long-term care event for us.
Sure. And this feels like to me, Glenn, this is something that these younger Gen Xers, they don't want to think about this. They don't want to think about, they're thinking about college. They're thinking about all these, but that really is a prime time to start to look into this, because any kind of cost they may endure, they are going to be, they're going to be in their working years, prime working years.
Absolutely. Again, long-term care costs is based on, right, what the cost is going to be when you're going to need care. And we're seeing big inflationary numbers on care costs right now. But with that said, when it comes to the planning for long-term care, it's not just the cost, it's your health. Right? If you wait too long to plan for long-term care, you might find yourself with a health occurrence that may have been over, a cancer event that you're clear from. But now you find out that you're 5 to 7 years away from ever being able to pursue that long-term care benefit anymore because of that healthcare event. So not only are we trying to save money by planning earlier, we're also trying to get in when the options are lucrative to us, when we can qualify for the best vehicles and get the most leverage because we're still healthy.
Absolutely. This is a lot to cram into one segment on a radio show. If this is resonating with you, this is bringing up questions, give the folks at Haven Financial Group a call, 612-504-8400. We certainly understand that this can be very confusing for a lot of people. It's a lot of information, but what we're trying to do is just spur some thought in your mind about what you might need to do to take steps to make sure that you achieve the kind of goals that you'd like to in retirement. 612-504-8400. That's how you reach the folks at Haven Financial Group. Coming up next, we're going to talk about unique retirement tips for Gen Xers. Stay with us, everyone. This is the Haven Financial Group Radio Show.